Siaya County has made significant progress in improving the health, development and well-being of its newborns and children. Thanks to the strong county government leadership and coordination, supported by partners who are determined to help the children of Siaya not only survive but thrive to reach their full development potential.
In many jurisdictions, early childhood is something that is given a lot of priority, a lot of emphasis. Here in Kenya, we are having the early childhood from conception to 2 years being managed by a different ministry. In some other countries, it is just one. We had to harmonize the operations in health and operations in education. We have a multi-sectoral committee that runs that program.
As a county government of Siaya, we are very focused on matters ECD, and we are very happy and lucky that actually the initiative, the ECD as a services provision in the county is government-led. Nurturing care is not just the provision of education component or opportunity for early learning, but a subset of 5 components that is beginning with health, nutrition, responsive caregiving, security and safety, and opportunity for early learning. So we said we had to bring on board all different stakeholders, and that's how we came up with the multi-sectoral approach in the provision of nurturing care for early childhood development.
Early Childhood Development Program is a program that touches all sectors of the county government. It is a concept whose boundaries are limitless, and therefore, given that the children and the under 5s and the infants are a constituency which is voiceless, it is important that their needs are amplified and brought into the planning space of any government. And therefore, as a government, we decided that we need to mainstream children in our development agenda to ensure that we address their needs systematically.
We have integrated nurturing care services at all levels of our health service delivery. And we do this using so many players and or stakeholders. Key among them are our healthcare workers, particularly our community health volunteers, because these community health volunteers are right down in the villages. And the way our community health volunteers work is that we have assigned a community health volunteer to every household in this county. The county government has invested heavily on infrastructure that really give a foundation for this. The Office of the First Lady, Her Excellency, has been the backbone of nurturing care.
The first thing we did was to create an environment where policy formulation and even implementation is very smooth. Our systems and our structures that are already there are strengthened with what we already have.
The partners who are working with us very strongly at this point in time include PATH and KMET.
As partners, we have continued to collaborate very closely with the county government of Siaya to integrate early childhood development into its programs targeting mothers and young children. We have seen a lot of progress over the years, with the county leadership showing a lot of support for this program. So they've gone beyond just showing leadership to actual investment, where they are allocating resources to support integrated early childhood development into their existing programs. And that for sure is a sign of sustained programming around early childhood development.
What we are trying to do as a department is to initiate programs as per our CIDP that will help in enhancement of production. We have undertaken programs like promoting the kitchen garden This we have done in collaboration with other partners, and just recently about 300 kitchen gardening kits were issued to farmers from various centers within Siaya. So this is to help them have these very nutritious foods within reach.
Adequate nutrition is one of the components of nurturing care that is reinforced by government officers targeting children and their caregivers within the community and up to the household levels.
As a community health officer, my involvement in the implementation of nurturing care is in training. After being trained as a TOT, my responsibility is to go down and train the CHVs on nurturing care. I have to do mentorship at the facility during the playbook sessions. And also there is what the CHVs do when they visit the households at the community where we have children 0 to 3 years. So in these households, the CHV, when they go around every month, they visit the households, they introduce nurturing care. My duty also as a community health officer is to go down and do mentorship to make sure that the delivery of the message and the content reaches the households.
Kazi yangu ya Nyamrerwa imenifunza mingi. Saizi mtoto akilemewa ninajua ni kitu gani namfanya. Hapa Mahaya sub location tulikuwa na watoto karibu 4 wako na delaying milestone. Na tumeenda huko, hao watoto saizi wanatembea, wanaongea, wanacheza.
Biro Nyamrerwa no konya nikech Nyamrerwa mano otemo jiwa. Tani no lokruok nikech kura no konyalo wuotho, onyalo chiemo. Ka gwele kama bende ng'ise ni gem na gicha bende ogemo.
Jonyuol sani koro ung'eyo ni kara nyathi en ng'ama onega mi chance mare mag tugo kata jirani nyaka participate e weche mag nurturing care no indo.
Nurturing care is practical, it is beneficial to the young children. We have seen it work, and I can strongly recommend that the counties, they should implement so that they can see the holistic thriving of children.
If the child is not taken care of at the early stage, then they become deviants in future. And in order to avoid that, it is important that they are exposed to this kind of program, and so that each and every person becomes responsible for their families, and we shall be having responsible families in future.
We have not reached there yet. We are on that journey to reach there, where nurturing care will be the byword in everybody's lips in this nation.